Once a symbol of affluence and well-being, the Indian potbelly has taken on a more sinister identity in recent years. Once it was seen as harmless, even respectable, a visible cue that one had escaped the grip of poverty, that meals were plentiful, that middle age had been reached in comfort. But today, that same protruding belly is emerging as one of the most dangerous and underestimated public health threats in the country. It no longer reflects indulgence. It signals metabolic dysfunction, chronic illness, and an impending crisis that India cannot afford to ignore. The silent transformation of this symbol from status to silent killer should be a nationwide wake-up call. India is now caught in the throes of a growing obesity epidemic, and abdominal fat, the so-called potbelly, is at the heart of it. The numbers are stark and deeply unsettling. With 180 million overweight or obese adults as of 2021, and projections warning this figure could balloon to 450 million by 2050, India is on track to become the epicenter of a global health disaster. That would mean nearly one-third of the country's future population carrying excessive weight, much of it concentrated dangerously around their midsections. And the consequences of this are not cosmetic. They are lethal. The danger of the potbelly lies in the type of fat it stores. Unlike fat in the hips or thighs, abdominal fat, especially visceral fat that wraps around internal organs, is metabolically active and directly linked to life-threatening conditions. Type 2 diabetes, cardiovascular disease, fatty liver, kidney dysfunction, and even certain cancers all share a common contributor: central obesity. Yet this ticking time bomb has gone largely unaddressed in public discourse, often minimized because many of its victims don't appear obese in the conventional sense. In fact, a troubling number of Indians with normal weight by BMI standards are metabolically obese, carrying a dangerous amount of fat in and around the abdomen. This makes the problem not only widespread, but insidious. You don't have to look overweight to be at serious risk. South Asians, in particular, are biologically predisposed to store fat inefficiently, and their bodies are less capable of safely tucking fat away beneath the skin. Instead, it gets deposited into vital organs like the liver and pancreas, organs crucial for maintaining healthy blood sugar levels and metabolism. As this fat accumulates, it disrupts insulin function, setting the stage for diabetes, one of India's fastest-growing diseases. It also inflames blood vessels and increases the likelihood of strokes and heart attacks, now common causes of premature death across the subcontinent. What makes the picture even bleaker is how early these patterns are setting in. Abdominal obesity is not confined to older adults. According to India's latest National Family Health Survey, nearly 40% of women and 12% of men are already dealing with abdominal obesity. Among women aged 30 to 49, nearly 1 in 2 is showing dangerous waistlines. These are prime working years, prime parenting years, prime earning years. Yet millions are carrying invisible health liabilities that threaten to cut those years short. Urban areas, where fast food and sedentary work dominate lifestyles, are particularly vulnerable. But rural populations are not immune, especially as junk food becomes more accessible and traditional diets give way to convenience meals loaded with sugar, salt, and trans fats. Between 2009 and 2019, India saw one of the fastest increases in the per capita consumption of ultra-processed foods globally. And with technology making physical effort less necessary across all income levels, energy expenditure is plummeting just as calorie intake skyrockets. The result is a toxic health cocktail: less movement, more food, and a body that isn't equipped to cope with the imbalance. Even more concerning is that the response has been slow and fragmented. While awareness around general obesity has grown, the specific risks of abdominal fat still don't get the urgent attention they deserve. Indian health systems still rely too heavily on BMI, an outdated measure that fails to capture the full picture for South Asians. Fortunately, some experts are trying to change that. New guidelines now classify obesity in 2 stages, one without abdominal fat and a second more serious stage with it. The second stage, which includes the deadly visceral fat, demands more than light exercise and minor diet tweaks. It requires aggressive intervention, structured treatment plans, potentially lifelong medication, and rigorous lifestyle overhauls. Some relief may come from emerging medications like semaglutide and tirzepatide, which target weight loss and metabolic regulation. But even here, the optimism must be tempered. These drugs are expensive, not widely accessible, and come with potential side effects. They also don't replace the need for systemic, lifestyle-based solutions. The reality is that medication cannot fix a culture-wide crisis. Prevention, rooted in awareness, education, and policy, is the only sustainable path forward. And yet, prevention will be no easy task. South Asians have a naturally slower metabolism and store fat differently than other ethnic groups. While 150 minutes of weekly exercise might be enough for a European male, an Indian man needs nearly double that to maintain metabolic balance. Unfortunately, the average Indian lifestyle today is trending in the opposite direction: more desk jobs, more screen time, fewer home-cooked meals, less daily movement. This trajectory, if left unchallenged, will overwhelm India's healthcare system. Already, hospitals are seeing younger and younger patients with diabetes, hypertension, and heart disease. Productivity will take a hit as the workforce becomes increasingly plagued by chronic illness. Healthcare costs will soar, not just for individuals but for the nation. And while the rich may have access to the latest treatments and interventions, the poor, who are just as affected by unhealthy food and inactive lifestyles, will bear the brunt of the suffering. The potbelly is no longer a joke or a harmless family trait. It is a warning flare in the night sky. And ignoring it comes with steep consequences. India must confront this growing crisis with the seriousness it demands, recognizing that abdominal obesity isn't just about comfort or appearance, it's about survival. Every waistline that creeps past the danger zone is a potential emergency in slow motion. And unless the nation rethinks its food systems, redefines its exercise norms, and recalibrates its cultural attitudes toward health, the potbelly will continue its quiet evolution from status symbol to executioner.